And we started very slowly. We talked to the physicians, we educated the physicians. We spent a long time preparing to start a program, and then partnered with Javara with some of our practices, and had, over the course of the next year, a really positive response. The model being a little bit different, so that it's not clinical research, doctor, figure that out, here's the project, you get that done, we'll pay you, what it takes to do that. But it was more of, here's the project, are you interested? And then the Javara providing the support services, not the clinical supervision, but the support services around that supervision, taking a lot of the burden off of the physician from doing administrative tasks. The ideal situation for clinical research would be with physicians and the research partner really looking like one team and treating each other like one team, not like a vendor, not like a service provider, like, hey, you're giving me this, but I don't want you doing that, or that. So don't interrupt my office flow, stuff like that. It is together, one team, I think, is a critical concept. And what we've decided is we need to ensure that process. It's so important to keeping those teams functioning, and that's so important to keeping them interested in their job and the physicians interested in doing clinical research. And for value-based care, where you actually are paid more for taking better care of a patient, then being able to provide these services to patients who otherwise couldn't get that kind of treatment, an almost concierge experience for patients who have a hard time accessing healthcare. I mean, we did a lot of education, talking, and listening to our physicians before we launched, and our partner Javara did the same. We went around kind of as a team to listen to what was going on. I put very little pressure on the doctors. I can tell you that it's not my way of operating. I said, look, I want you to really want to do this, but a lot of them are still very interested. As a physician, you're trained as a scientist first. You're trained to try and understand what a research project should do, what the outcome might mean, be able to test those concepts. So here's another thing we can offer our physicians, along with the usual enablement services that we provide. So one thing. The second thing is revenue. There is revenue generated by these studies. Our goal is to engage the physicians in clinical research and have most of our principal investigators have a number of studies that they want to have, right? We're not forcing them. That can provide them a steady stream of revenue that is independent of winning on a value-based contract or not. I think it's a differentiator, frankly. I do think that medical groups that can do this, do it effectively, show results, will be differentiated in the marketplace. Patients will seek them out, and payers will seek them out. I think many of the payers that we've spoken to are very excited about the opportunity. Many of them have clinical research offerings as well. I think that the first thing is, for the leadership to learn, and then to educate the providers about clinical research. And not just one thing about clinical research, but about the different models of clinical research, the pros and cons of what can happen with clinical research. By the way, I think the responsibility of making sure that you're watching out for these patients, right? These are patients who are coming and you're providing a service to them that would not be, the typical everyday service you do in your office, so that the patient has to be, got to watch out for them and make sure that you're meeting your commitments and responsibilities to compliance and monitoring. The second thing is, don't hurry. Once you know how it's going to go, once you start to predict what works and what doesn't work, then you can go at a faster pace. But I would say early on, go slow. The third thing I would say is I would spend some time investigating the partners, right? Who are we going to do this work with? And we picked Javara in particular because we didn't want to build these resources. I'm not an expert in clinical research, right? I don't have deep relationships with pharma, and I have a much better understanding of the risks and benefits. But I would say that I want an expert